Hi, today we're here. My name is Terry. I'm one of the nurses. I'm going to be taking a health history on you today regarding your head, eyes, ears, nose, and throat. We're going to discuss your health history, and then afterwards I'm going to perform a physical exam on the same portions of your body, also known as an HEENT. Again, my name is Terry, and I'm one of the nurses. Mr. RH, I'd like to talk to you today about your head. Do you have a history of headaches?
No.
Have you had any head injuries?
No.
Any history of dizziness?
No.
History of neck pain?
No.
Do you have any limitations in your motions, moving your head around? Any limitations with that?
No.
Any history of lumps or swelling in your head?
No.
Moving on to your eyes, sir. Do you have any vision difficulties? Any blurriness, blurry vision,
No.
spots before your eyes? Do you have or had any pain in your eyes?
No.
Any redness, swelling, or itching?
My allergies.
What do you have with that? Redness, swelling, and itching for your allergies? Okay. How often does that happen?
Springtime?
Springtime? Okay. Do you also have watery and drainage from the eyes?
Yeah.
The drainage, is it yellow or is it clear?
Clear?
Okay. Any past history of any ocular problems at all?
No.
Okay. Any history of glaucoma?
No.
Do you use eyeglasses, or have you ever in the past, or contacts?
No.
When was your last eye exam?
Couple months.
Couple
Summer.
In the summer? Okay. Because you know it's very important to have your eyes examined at least once a year, unless otherwise noted by a doctor or an eye doctor. Moving on to your ears. Do you have any history of earaches, infections, of discharge? No. Okay. Any hearing loss?
No.
Have you ever been exposed to environmental noise?
No.
Such loud noises in your job or?
No.
No? Okay. Any history of tinnitus that's ringing in your ears?
No.
Any history of or problems with vertigo or dizziness, climbing a ladder, getting dizzy?
No.
Okay. How do you clean your ears?
With a Q-tip.
With a Q-tip? Okay, and you know not to go too far down because you don't want to rupture the eardrum or tympanic membrane. Okay, you can also use a warm washcloth to wipe around the outer surface of the ears. Okay, moving on to your nose. Do you have any discharge from your nose?
Allergies.
For when you have allergies, seasonal allergies, correct? Okay. Do you have a history of frequent colds or upper respiratory infections?
Sometimes.
Sometimes. Okay. Is that with the change of the change of the seasons?
Yeah.
Or okay. Do you have a history of any sinus pain?
Yes.
When the respiratory infections or the allergies act up? Okay. Any nasal trauma in the past?
No.
No? Okay. Do you have a history of nosebleeds?
No.
And you did state that you have allergies. Do you have any issues with any smell?
No.
All the foods and stuff like that smell? Okay. Normal? Okay. Moving on to your mouth and throat. Do you have any sores or lesions in your mouth? Cuts?
No.
No. Do you have a history of sore throats?
One of allergies.
Your allergy. Okay. Do they itch? Do you have an itchy throat then too?
Yeah.
Okay. Do you have any history of bleeding gums?
No.
Yeah. Okay. How about a history of toothaches?
No.
No. Okay. Do you have or have had hoarseness? When you're trying to talk, is it hoarse and your voice changes a little?
Allergies.
When your allergies act up? Okay. Do you take any medicine for the allergies?
Yeah, like Benadryl.
Is it prescribed? Okay. Over-the-counter medicine?
Over the counter.
Okay. Do you have any difficulty swallowing?
No.
Okay. Any problems or alterations in taste?
No.
Yeah. Okay. Do you wear dentures?
No.
Do you have any crowns on your teeth or braces?
No.
Okay. Do you get routine dental care?
Mm-hmm.
Okay. And cleaning should be done every 6 months unless otherwise noted by your dentist. Okay. Okay. Any other issues or problems you'd like to discuss today regarding these that we talked about? No? Okay. Very good. I'm going to perform your exam now. Okay. I'm going to go over and wash my hands. I've washed my hands. I've come over to the patient. And now I'm going to start with his head.
You start by inspecting the head and hair, looking for patterns of hair growth, dry scalp, symmetry, and lesions. Next, palpitate the head, looking for lumps. Next, palpitate the temporal artery on both sides of the head. Move down the face while placing your hands on the cheek and jaw. Ask the person to open and close their mouth, looking for signs of TMJ.
Your mouth, please.
Next, we will assess the neck, looking for symmetry, position, and range of motion. We will palpitate the lymph nodes, pre and post auricular and optical, and move down the superficial cervical and deep cervical chain. Now move on to the submandibular and submental, and the jugulovodrastic. We will ask the patient to tilt their head forward and check the supravalvular nodes. We will next check the range of motion. Ask the patient to turn their head right and then to the left. Try touching the ear to the shoulder without struggling the head. Extend the head backwards.
Put your head backwards. Okay.
Next, we will inspect the eyes. Inspect the eyebrows, lashes, look for evenness and symmetry. Look at the facial expressions. Look for redness of the skin. Inspect the eyes for symmetry, looking for drooping. Next, ask the patient to look up and down and side to side, looking at the conjunctiva and the sclera. The lower eyelids should be pink, and the sclera should be white. Next, using your pen light, shine the light from side to side across the cornea to check for smoothness and clarity. Next, inspect the iris and the pupils. The iris should be round, regular shape, and even in coloration. The pupils should be round, regular, and equal of size. To test the papillary light reflex, we would darken the room. To test for accommodations, we would ask the patient to focus on a distant object. This process dilates the pupil. Next, shift the gaze to a nearer object, such as your finger. Normal responses should include papillary constriction and converge of axis of the eyes. We would record Next, we will do the 6 cardinal positions of gaze to elicit any muscle weakness during movement. We would record this as polera, pupils equal, round, react to light, and accommodation. Next, we will inspect the ears, looking at the surrounding tissue and cartilage, noting alignment and symmetry. We would normally use the osteoscope for this procedure to inspect the canals, tympanic membrane. Using the osteoscope, we will pull up the pinna and back on an adult to straighten the canals. Note redness, swelling, lesions, foreign bodies, or discharge. If discharge is present, you would note the color and odor. Inspect the tympanic membrane. Normal is shiny and translucent with a pearl gray color. Next, check for a person's hearing acuity, testing one ear at a time. Ask the patient to cover their ears using the whisper test. Whisper to the patient, noting their ability to hear. Do both ears. Next, using the tuning fork, test the air condition.
Can you hand me the tuning fork, please?
Test the air condition and bone conduction.
You're the same on both sides.
Weber's test, which is for bone condition using the tuning fork, places it in the middle of the patient's head and asks them if the sound is the same on both sides of the head. The Rhine test compares the air condition and the bone conduction. Placing the tuning fork on the mastoid process, ask the patient when the sound goes away to invert the fork near the ear canal. Next, we will inspect the nose and the internal and external areas, looking for symmetry, deformities, or lesions. Palpate each nostril for patency. Check airflow by asking the patient to hold one nostril at a time and breathe out. Inspect the naval cavity, looking at the naval septum, looking for color and integrity of nasal mucosa, septum for division or bleeding, looking for drainage, noting color, looking for swelling or polyps. Inspect the palpate and the sinus and ask the patient if they have any pain. Next, inspect the thyroid for size, shape, and symmetry. Next, we will move to the back of the patient to access the thyroid gland. Ask the person to slightly bend their head forward, place the fingers of the left hand on the neck, and push on the trachea slightly to the right. Use the other hand to feel as the person swallows a drink of water. The thyroid moves up under your fingers with the trachea and the larynx when the person swallows. Next, we are palpate the carotid artery on each side of the neck, using the bell of the stethoscope to listen to the artery while you ask your patient to hold their breath.
Hold your breath. Good breathe. Hold your breath.
Next, we will inspect the mouth and throat. Look at the lips for color, moisture, cracking, and lesions. Inspect the teeth for straightness, evenly spaced. Ask the person to bite and note the alignment. Gums should be pink or coral with a dotted surface. Check for swelling, bleeding, or discolored gums. Use a tongue depressor or a gloved hand and a pen light to inspect the tongue for color. It should be pink. Inspect the buccal mucosa. That should be pink in color too. Next, inspect the palate. The hard palate is white with an irregular transverse rugae. The posterior soft palate should be pink and smooth. Ask the person to say ah, noting if the soft palate and the uvula rise in the midline. Next, inspect the tonsils. Should be the same pinkness as the buccal mucosa. Now we're going to use a cotton ball and Q-tip to test for sensation. We're going to instruct the patient that the soft part of the Q-tip is for softness and the point of the Q-tip is for hardness. Ask the patient if they can distinguish the difference.
Soft. Soft. Hard. Soft. Soft. Hard. Soft. Soft.
All that failed to see. That concludes our exam for the head, eyes, ears, nose, and throat. Thank you.